January 31st in 2020, there were 6 confirmed cases of COVID in the U.S.
The federal government declared the virus a public health emergency. On Friday, that emergency will end. The change comes days after the World Health Organization ended its global health emergency concerning the virus. COVID-19 continues to mutate and spread, but state health officials believe we have reached a major turning point.
I feel like 3.5 years was a long time. I do think, though, that we are now ready to make this step. I really believe that's critical.
That's Cheryl Peterson-Krober. She's the Assistant Commissioner at the Minnesota Department of Health. We talked today about what this change means for Minnesotans.
We've been living with the virus for well over 3 years, the first year being the toughest. Many people lost their lives and people had to change how they lived their lives. But that period feels like it's in the past and will stay there.
Yeah, we're hoping so. We've come a long way since then. It took medical professionals and scientists all of those days to figure out how we reach a point where COVID isn't in control. And in the beginning, all we knew was to social distance, wear masks, get tested. And even that was difficult to attain at first and get the results quickly. Assistant Commissioner Peterson-Krober says all those who were researching COVID needed the past 3 years to better understand how it spreads, how it mutates, how people react to it and recover. But now, she says, we are more prepared than ever to end the emergency.
It means that we're at a point where we can now say to people, we have many tools in the toolbox that will keep us from having some of the devastation that was caused by COVID in the early days. We have testing, we have therapeutics, and we have, the most important to me is vaccine. That's the most important tool we have in the toolbox. And so it means that we are now at a place where we can manage the virus with the tools that we have.
In the first 2 years of the pandemic, we were getting constant updates. I mean, we all remember that daily at times of how the virus was spreading. MDH was tracking case counts, available hospital beds with different strains and where they were originating from. So how will MDH operate moving forward?
Well, there will be some adjusting, but the researching and the tracking won't stop. So I was told the amount of data shared with the public will change, but it will still be available on the website, similar to how MDH tracks the flu. MDH is studying long COVID to see how it's impacting people well after they catch the virus. And another key point we wanted to know, though, is what protocol should we follow if we catch COVID? Is it different now that there isn't a public health emergency? The answer, keep doing what you've been doing, starting with self-quarantine and social distancing.
I think what's important is if you have symptoms to test yourself. I think with all the telework that people have been doing, often you can stay home from work. You may not, you may have to call in sick for a couple days, but if you read the guidance, and again, it is guidance at this point in time, you can go back to work if you're not having symptoms after 5 days, and you're encouraged to mask for those remaining 5 days so you get to the 10. I think you'll also notice that there are quite a few people still in public who are masking, and I think that will be a change for us as a society in general. We will, if you're sick, cover your own cough. It's the same concept.
And the last part worth touching on here is vaccine. She said that's our best tool in the toolkit. So what guidance should we be following there? Can we expect them to be a yearly shot similar to like our flu, the boosters? Yeah,
we've gotten used to that. But that part, she says, is still unclear. COVID, as we know, hasn't followed a flu schedule where there's a new vaccine that comes out every late summer. What they're advising now for adults is to get the bivalent vaccine if you haven't yet. If you've already received the bivalent vaccine and you're over 65 years old or immunocompromised, you can get a second dose. Just make sure it's been a few months since the first. The rules here are a little different for children 5 and under, so we want to make sure parents talk with their healthcare provider to learn what's best. So here, what we've learned today is that we've learned a lot about the virus over these 3.5 years and how to combat it, but the work is far from finished.